This video, Positioning for Soft Tissue Work, is intended to give you a variety of different possibilities to position your subject in a variety of situations and be most helpful to you in the work that you do. So let's start from the head into the body cushion, and we'll consider some of the positioning possibilities that the body cushion affords us. First, we have the ability to move the head and neck laterally into lateral flexion. And this is a really dynamite ability. This gives us the opportunity to stretch the muscles along one side of the neck. While we palpate, we can sensitively go into the shortened musculature on the opposite side of the neck and discern areas of tension and anomalies. So this ability of moving the head and neck laterally is just a really, really nice ability. Works really well face down. In this position with the arms in the Sphinx position, the upper musculature of the shoulders, the upper trapezius are shortened. And when those trapezius are shortened, this gives us the ability to release those muscles and work more effectively with the neck. So the idea of having your client, your patient, your athlete face down and being able to position that neck and head to the side is really, really beneficial. One thing I want to point out, when you move the head and neck laterally, you want to kind of distract or pull away at the occiput. Sometimes at the base, you can just put your hand under the base of the face support and induce a little bit of traction. So in doing so, you're not compressing that flexed side of the neck. Now, one thing you'll find with your subject of a longer neck, you're going to find a limitation that the straps of the body cushion impose, the connecting straps that connect from the chest support to the bottom of the face support. So what you can do is reach underneath and just detach those and therefore release that otherwise limitation. Okay? I just want to point that out to you because there's some marvelous stretches that can happen when you compress the upper portion of the trapezius and then go into the occiput. Okay, likewise, other side, we can just detach that. Now, in many cases, you'll have the draping set up where a sheet is covering the body cushion, chest, and pelvic parts, and the face support's resting on top of that sheet. So in that case, you wouldn't have to concern yourself with separating the straps. But in situations where the straps are separated, just be mindful that you can go beyond the limitations that the straps impose. Sometimes, if you want to work and do resistive kinds of things, positioning possibilities, working with your subject face down, and have the ability to slide that face support freely, you can even remove the Velcro on the bottom part of this base under the crescent that supports the crescent. And that affords a nice, free, easy motion with the plastic of the face base sliding across the sheet. So let's point that out. That's a nice ability. Let's talk about using some of the adjusters and how they come into play. If Rochelle here were of a longer torso, I would be employing the use of the extenders. And those would fit in between the chest and pelvic supports. And I want to point out I'm using body cushion covers. These are 100% cotton and washable. And they're designed to also fit around the addition of one of the extenders. And the extenders attach one on each side of the chest and one set either side of the pelvic. And again, the chest and pelvic covers, elastic fitted cotton covers, are the same. Either one will fit either part, and they're large enough and stretchy enough to fit around one set of extenders as well. But we're going to take the small wedge, and notice I have the 100% cotton elastic fitted covers on these, and that makes it nice to handle it. They don't get oily, and it assures the longevity of these parts. Now I'm going to have you raise your chin a little bit, and I'm placing that small wedge under the jaw portion of Rochelle's face support. This inclines the neck to be more in flexion. Now also we can move the head and neck to the side into lateral flexion so that we can induce a little more positional stability I'm going to place that angle in this way, which is going to incline to keep her head and neck in that position so that the tension in her neck isn't going to incline that to return to a neutral position. So that's one positioning possibility you're going to want to be aware of with the small wedge. It can serve in a variety of ways. If you want to work for a time with your patient's neck in extension, you can raise the relative height of the forehead and therefore shorten the muscles along the posterior aspect of the neck. So it just affords you abilities of shortening particular specific muscle groups in ways that allow you to employ the principle of positional release to get the release of the muscles, and also to afford you better approach to palpating those muscles as well. Now, considering the support for our subject's torso, I'm going to add a large wedge alongside, and I'm going to split the difference between the chest and pelvic parts to fully support under the pelvis and the ribs. And in doing so, with that additional elevation, we are allowing the positioning to elongate the lower spine, to provide more elevation and decompress, and even ease more the patient's ability to take a nice deep breath. Take a nice deep breath, Rochelle, and just let it go. And breathing deep down, deep breaths in the abdomen will incline the low back to stretch even more. So again, we're using gravity, the force of this planet, as a modality, an adjunct modality to whatever we're doing with our hands. Of course, we could be using iStim, ultrasound, other modalities as well, but this tool affords us a modality in itself, and by itself is therapeutic. So here we have a situation where we have utilized the small wedge and the two large wedges, and your patient now is in very restful repose. I want to point out that in positioning your patient's lower extremities, it's nice to have that knee out a little bit, and what that does is that induces a little bit of external rotation, and that shortens these spanning muscles that span across to the greater trochanter and releases the SI and the SI joints. Nerves are released, and your imposition of pressure is released on the low back, so that this just really lets us get into these hip muscles readily.